Imagine you're trying to click on this video and suddenly your hand decides to act up on its own. It clicks on something completely different as if it has a mind of its own. Strange, right? It feels like your hand doesn't even belong to you anymore. It's foreign, it's alien. Exactly. Hi everyone, I'm Aksha, a student of Gitanjali College of Pharmacy, studying Pharmacy second year, and today I'm going to talk about alien hand syndrome. Have you heard it for the first time? Don't worry. By the end of this video, you'll not only know what it is, you'll also be able to tell your friends about it. Now, let's get into the topic.
Now, let's see what is alien hand syndrome. Alien hand syndrome is a rare neurological condition where a person's hand seems to move and act on its own without the person's conscious control. It feels foreign or like it has a will of its own, even though it's still physically part of person's body. Alien hand syndrome is also called as Dr. Strangelove syndrome is a category of conditions in which a person experiences their limbs acting on their own without conscious control over the actions. There are a variety of clinical conditions that fall under this category, most commonly affecting the left hand. There are many similar terms for the various forms of the condition, but they are often used inappropriately. The affected person may sometimes reach for objects and manipulate them without wanting to do so, even to the point of having to use the controllable hand to restrain the alien hand. The occurrence of alien hand syndrome can usefully conceptualized as a phenomenon reflecting a functional disentanglement between thought and action.
Unbuttoning your shirt, grabbing objects, or even hitting you. All this without your control. Sounds like something from a horror movie, right? But for people with alien hand syndrome, this is real life. This rare and fascinating neurological condition challenges our understanding of body ownership, brain control, and consciousness. Now, let's dive into what causes it.
Alien hand syndrome arises due to damage to specific areas of the brain that control voluntary movement, motor planning, interhemispheric communication, and body ownership. Depending on the location of the lesion, the symptoms and behavior of the alien hand can differ. It is of three types: corpus callosum lesions, frontal lobe lesions, and parietal lobe lesions.
The first one is corpus callosum lesions. The corpus callosum is the bridge which connects the left and right brain hemispheres. When it's damaged, for example, corpus callosotomy surgery is done to treat epilepsy. Then the communication between both the hemispheres is cut off. The motor commands which are generated in the dominant hemisphere, which is usually the left one, can't cross over to the non-dominant hemisphere. Then this results in the non-dominant hand acting autonomously because it is not receiving proper inhibitory signals or commands. This can also lead to intermanual conflicts where the one hand undoes what the other hand just did. For example, your right hand buttons the shirt, then the left hand unbuttons it. This is the classic form of alien hand syndrome. The second one is frontal lobe lesions. This is usually caused by stroke, frontal lobe tumors, neurosurgical injury, and traumatic brain injury. The supplementary motor area is responsible for planning and initiating voluntary movements. When the supplementary motor area is damaged, it leads to the loss of conscious initiation. But the primitive grasp reflexes and automatic motor pathways remains active. This causes the alien hand to reach out, grab objects, and perform actions which the person didn't intend to. And the last one is parietal lobe lesions. This is caused by parietal lobe stroke and neurodegenerative diseases, especially corticobasal degeneration and occasionally Alzheimer's. The parietal lobe integrates the sensory input and constructs body schema. Lesions here leads to the loss of proprioception and sense of ownership to the limb. The person may not recognize the limb as their own and even think it belongs to someone else.
Let's look into some case studies. Let me tell you about Karen, a 55-year-old woman, active, independent, and full of life. Everything changed one morning when she woke up after having a stroke. At first, the recovery seemed normal, but within days, something strange began to happen. Her left hand started moving on its own. It would unbutton her shirt, it would slap her face, or push objects off the table without her permission. Even worse, Karen began to feel like the hand wasn't hers anymore. It started after Karen had surgery at 27 to control her epilepsy, which had dominated her life since then. Cutting the corpus callosum cured Karen's epilepsy but left her with a complete different problem. Initially, everything seemed fine. Then her doctors noticed something extremely odd behavior. She has suffered from alien hand syndrome for 18 years, but fortunately for Karen, her doctors have found a medication that seems to have brought the right side of her brain back under some form of control. Karen's story shows us just how mysterious and powerful the brain can be. Now, let's look into this video, where the left hand forcefully unbuttons the shirt and the right hand tries to stop it, which causes the intermanual conflict between both the hands. And if you look here, the person does not have any conscious control. It acts as if it has a mind of its own. Let's learn about another case study, where rehabilitation of a 61-year-old man with alien hand syndrome. A 61-year-old man presented to the emergency department where investigations revealed a semi-recent ischemic stroke. He had a history of diabetes mellitus type 2, a transient ischemic attack in 2016, and back surgery. He was transferred to a multidisciplinary rehabilitation center. During the therapy sessions, it was noted that the patient's right hand unwittingly grabbed objects during exercises and grabbed the door of the treatment room when driving out with his wheelchair. He could not voluntarily release his grip, but he needed help from his left hand. His hand had become alien hand which could no longer can be controlled. And the third case study is about a 70-year-old woman, alien hand syndrome associated with corticobasal degeneration. The 74-year-old right-handed lady was diagnosed with Parkinson's syndrome by corticobasal degeneration 4 years ago. She reported a progressive stiffness of her right hand and an irregular tremor later starting. Furthermore, she claimed that she could not control her right hand and that she felt like this hand had a own life. Sometimes she had difficulties to loosen the grip of this hand. Stiffness and tremor progressed to the left hand in 6 months and to the right leg since 2 months with subsequent gait disorder. Currently, the patient was not able to use her right hand for simple tasks. Tested the patient for ownership illusions of the hands and general tactile processing. Results revealed that when blindfolded, the patient recognized touch to her alien hand only if it was presented separate from touch to the other hand. Delivering touch synchronously to both the alien and the healthy hand resulted in failure of recognizing touch to the alien hand. Thus, alien hand syndrome here coexisted with right-sided tactile extension and is one of only very few cases in which the alien hand was felt on the right side. Here we can see a person choking himself. This occurs when a part of your brain connecting both sides is damaged. This causes the nerve to involuntarily fire, making it move by itself. While choking is pretty rare, the alien hand also performs different activities without conscious control. Symptoms of alien hand syndrome. The first one is involuntary but purposeful hand movements. The hand may reach, grab, touch, or manipulate objects on its own. The second one is loss of control over the hand. The person is unable to stop or command the hand's actions. The third one is sense of foreignness or detachment. The hand feels like it doesn't belong to the person. Some patients even say, "It's like someone else is controlling my hand." The fourth one is intermanual conflict. This one's really wild. The hand undoes what the other hand just did. And the fifth one is unintended grasping. The hand may pick up objects or grab people or clothing without the person's intention. The sixth one is personification of the hand. Some people talk to the hand, blame it, or feel like it has a mind of its own. And the last one, seventh one, is no muscle weakness or numbness. The hand is physically healthy, it just acts independently. Now that we understand the strange symptoms of alien hand syndrome, let's talk about what causes it, or more specifically, what increases the risk of developing it. These mainly involve damage to brain, especially areas involved in motor control and interhemispheric communication. The first one is stroke. The most common cause is stroke, especially if it affects the frontal lobe, parietal lobe, and corpus callosum. Damage to the corpus callosum can disrupt communication between both sides of the brain, and that's when the hand might start doing its own thing. The second one is brain surgery. Some people develop alien hand syndrome after brain surgery, particularly if they've had a corpus callosotomy, which is sometimes done to treat epilepsy. In these cases, the surgery unintentionally disconnects signals between brain regions. The third one is neurodegenerative disease. Certain progressive brain disorders like corticobasal degeneration, Alzheimer's, can lead to alien hand syndrome too. These diseases slowly damage areas of the brain involved in movement and awareness. The fourth one is brain tumors. Tumors in the frontal and parietal lobes can interfere with motor control or body awareness and cause symptoms similar to alien hand syndrome. And the last one is head trauma. And yes, traumatic brain injury like from a car accident or a fall is another risk factor. If the injury affects the motor system of the brain's midline structure, it can lead to involuntary hand movements. Alien hand syndrome is rare and doesn't have a specific lab test for confirmation. So, its diagnosis is mainly clinical, supported by neuroimaging, and involves ruling out other conditions. The first one is clinical history and patient interview. This is the most crucial part of the diagnosis. The doctor takes detailed history from the patient. The doctor looks for involuntary but purposeful movements and unintended grasping. Also, the sense that the hand feels foreign or alien. Episodes of intermanual conflicts and any recent stroke, brain injury, and surgery. The second one is physical and neurological examination. Observe the patient's hand behavior, test for reflexes, motor function, and coordination. Make sure there's no muscle weakness or sensory loss. Third one is neuroimaging. MRI or CT scans are used to identify brain lesions or damage. The fourth one is electroencephalography. Helps to rule out epilepsy, useful when symptoms could resemble motor seizures, rarely used alone for diagnosing AHS. The fifth one is differential diagnosis. Alien hand syndrome must be distinguished from epilepsy, compulsions, psychogenic movement disorders, and stroke. The goal of treatment is to manage symptoms, regain some control, and improve patients' quality of life. The first one is treating the underlying cause. If alien hand syndrome is caused by a stroke, tumor, or neurodegenerative disease, doctors focus on treating the primary conditions. For example, for stroke, antiplatelet therapy, blood pressure management, and stroke rehabilitation. For tumor, surgical removal or radiotherapy. For neurodegenerative diseases like corticobasal degeneration, supportive care. And the second one is behavioral and occupational therapy. Mirror therapy. A mirror is placed between the two hands so the patient sees the reflection of the normal hand. This tricks the brain into thinking the alien hand is under voluntary control. Task based training. Repetitive tasks are used to reprogram the brain and reduce involuntary hand actions. Hand distraction techniques. Giving the alien hand an object to hold can reduce random movements. Constraint induced movement therapy. The functional hand is restrained, forcing the patient to use the alien hand under supervision. Helps build awareness and reconnect brain circuits, but used cautiously. The third one is cognitive and psychological support. Alien hand syndrome can cause emotional distress, frustration, and embarrassment. Cognitive behavioral therapy helps patients cope up with psychological impact. Some patients develop a detached relationship with the alien hand. So, therapy aims to normalize the experience, improve emotional adaptation, reduce anxiety, and social withdrawal. The fourth one is medications. Clonazepam is sedative that can reduce movement severity in some cases. Botox injections injected into specific muscles to weaken overactive movements. And the last one is adaptive techniques for daily life. Wearing a glove, weight and wristbands to keep the hand in place during the rest. Home modifications to reduce safety risk. Reference. Our discussion is supported by findings from these links.
Hope you all understood what is alien hand syndrome. If you all have any questions, please feel free to comment down. And thank you for watching the video.